Hello, I'm Ellie Nieves, and welcome to the Leadership Strategies for Women podcast. As the founder and president of Leadership Strategies for Women, I lead seminars and webinars to help high-achieving women to show up, speak up, and step up in their careers. To learn more, please go to my website at leadershipstrategiesforwomen.com. You can also follow the Leadership Strategies for Women page on Facebook. So today we're talking about COVID-19, also known as the coronavirus. This certainly is a new topic for our podcast, but it's not off topic. As women leaders in our homes, in our work, and in our communities, this is our time to rise and shine. And what's most important is how we rise to this occasion. It's important that we be well informed because knowledge is power. And once we have that information in our hands, we can share it with our families, our friends, people that we work with, people in our communities, and people that we care about. You know, in our society today, in addition to doctors and scientists, there are others who are at the forefront of battling the coronavirus, including our mid-level providers, such as nurse practitioners and physician associates. And today we have someone who is very knowledgeable about this topic, who is going to join us and talk to us about what we can do to also join in the fight against the coronavirus. So today we are joined by Edwin Torres. Mr. Torres is a nurse practitioner in the Fleischer Institute for Diabetes and Metabolism at Montefiore Medical Center, which is affiliated with the Albert Einstein College of Medicine in New York. He earned his Master of Science in Nursing degree and has an advanced certificate in disaster management from SUNY Binghamton, where he is also a PhD student. And he's also a national contributor to US News and World Report. Mr. Torres, welcome to the Leadership Strategies for Women podcast.
Ellie, thank you very much for having me on your platform. And thank you to your audience for taking the time and listening to us in this critical time that our nation and our global population is in a crisis. We are in a national pandemic with the coronavirus, and it is important for us to stay informed, understand the facts so we can prepare and better serve our communities and our family members. So I appreciate the time to speak to your audience, and hopefully we can provide some of the answers to the questions that they have. And if we don't, they can always reach out to us.
So why don't we just start with the very basics. What is the coronavirus and what are the symptoms?
Okay, so it's very important for the audience to understand that this is not a Chinese virus. This is a virus that it's a family of viruses. It's not the first time that we see a coronavirus outbreak. In 2002, we had the first outbreak out of China, and that was with SARS, which is severe acute respiratory syndrome. Basically, this is a respiratory virus that attacks your airways, and then it causes some distress. With proper management, patients, they do well, and there's a pretty good prognosis. So COVID-19, that's the name that the World Health Organization provided this. This means the proper name for this is severe acute respiratory syndrome, coronavirus disease 2019-2. Okay, number one was in 2002. 2002, yes, and this is the number two. So this is a 2.0 version, pretty much, that we're looking at. We also had the Middle East respiratory syndrome. That was another coronavirus. The World Health Organization decided to call this COVID because the Middle East coronavirus syndrome brought some negative connotation towards the Middle Eastern region. And we don't want to create a negative perspective of a region because the virus, started there. So this virus is, it feels like the common cold, but it has a different characteristic. This is what we call a zoonotic infection, meaning that, we get it from an animal. So There are different speculation as to where this originated. The source is unclear, but bats and pangolin, they are, considered the culprit of this. And, bats, they are about 97% genetically similar to COVID, and the pangolins, they are about 99% genetically similar. So the way this will work is humans, we will come in contact with, an animal that carry this virus, and somehow the virus learns how to get into our system. In a typical, scenario, only that person will get affected and not be able to transmit it to others. But the virus now has learned to mutate in a way that it can be transferred from person to person. So now this is when it becomes a little more problematic for us as humans, because we interact, we're social beings, especially in cultures that hugging and shaking hands are very prevalent. So it is important to understand that this virus is transmitted from contact, that happens with you and the virus. So it could be from human to human or from a person.
So what are the symptoms?
And the symptoms for this, they are number one, fever. 80% of the patients, they will show up and they will have a fever. There was a study done by the World Health Organization in which we had 55,924 patients. This was out of Wuhan, China, which was where it originated. This is a region that has 11 million people. So they had the virus since early December. So the data that we first gathered was from the Chinese, and 87% of these folks, 80, you could say 80, 88, they develop fever. Then, cough, a dry cough follow, and then you have some fatigue. Fatigue is a very vague symptom, but if you have the fever, a dry cough, these are the culprit of this. People, now it's allergy season, right? So do I have, COVID, the coronavirus, or do I have allergies? You know yourself. We know it ourselves. We know, some of those who develop these allergies. What does that look like? Rarely allergies will come with fever. So if you have fever and, you don't feel well, we would like for you to, put yourself, quarantine yourself and contact your provider until we rule out that you have this virus, yes or no.
And you kind of touch on the next question, which is, a lot of people who might be experiencing symptoms, they don't necessarily know what to do in a moment like this. Many people might go and run to the emergency room. We've gotten some information through the news as to what people should do, but tell us, what should they do? Should they call 911? Should they call their doctor, Department of Health, run to the emergency room, self-quarantine? What is the best approach if you think you have?
So it's very important to know that chicken soup is very good when you go into the situation. It helps, it gives you some comfort. And 81% of the people, they're just gonna have mild symptoms. You might have a little bit of fever, you might have the cough, and it will resolve on its own. You will be okay. In 1 to 2 weeks, you're gonna feel better and you're gonna move on. The challenge becomes to about 14% who will develop a severe case. They're gonna have to get some type of respiratory assistant when we bring them to the hospital. And then we have 5% that become the critical cases. And these are the patients who will end up in the ICU. And so if you're at home and you develop the fever, develop the cough, you can treat it just the way you treat, your other symptoms. You have a fever, you can take your Tylenol, and that's gonna help with that. Take a chicken soup so you can stay hydrated and feel comfortable. Now, if you develop, respiratory distress, then that's an indication for you to go and seek care at your emergency room. The reason we want people to stay home is because we need our hospitals to be there for the people who need it, for those that fall into that 14 and 5%, which is 19% of the population that will eventually need to seek help.
So basically, you should self-treat if you feel that you're coming down with some symptoms, and self-treating could include what you would normally do if you had a cold or maybe a flu. So take some Tylenol, get enough rest, stay hydrated, have some chicken soup, as you said, and then
Absolutely.
only seek medical attention if you feel that you're starting to have shortness of breath and that you might get into a more distressful type of situation. And of course, everyone knows this, we should self-quarantine if you do have any indication that you're feeling like you're not feeling well.
Yeah, absolutely. And, so people, they get anxious because, of course, you see the media, you see the news, and, it's a very scary disease. It's a sexy virus right now. But understand that, let's say if you have these symptoms of the fever, the dry cough, the malaise, um, to test you and to find out that you have it, the treatment is going to be the same. So if you have it and it's going to resolve on its own, we don't need to test you for you to have it. We have a shortage in the country of testing. So right now, the president said they're working on it, but it still needs to trickle down. So we want to save those kits for those folks who will be coming in and that we really need to rule out what's going on with them.
So I've also been reading that there are some distinctions and differences in terms of how people are impacted, whether you're male or female, or whether you're from an older generation or a younger generation. And you could see it in the mortality rates. Can you talk a little bit about that?
Absolutely. I've always said that females are stronger than men, and this is another proof that it shows that they are. But it's important to know that the numbers that we have, they are from China, and now from Italy, we're starting to see some numbers. Numbers are coming out of New York City, which is the epicenter in the United States. As far as female and male, yes, males, they tend to do worse, but the difference is very minimal between them. But yes, females, they are doing better. As far as the older population, this is a population that is vulnerable. And we have seen that those patients that are over the age of 60 with a history of cardiovascular disease and diabetes, they are fairly worse with this disease, with this virus. There are some theories that shows that there is some myocardium dilatation of the heart, and that could be one of the mechanisms through which this is affecting folks. So the older folks in general, the old rule apply that are vulnerable, the older, the sicker, we need to take care of them. For some reason, we're not seeing the same in the pediatric population. They are doing they're doing better. If anything, they get the virus and they become a transmitter of the virus because they just don't get as sick as the older folks.
So you and I, we both live in New York, and our governor has been providing us with daily updates. And one of the things that he's been saying is that it's going to get worse before it gets better. So from what you're seeing nationally or even internationally, what is the average rate of infection?
So that is a very important question, because if we're learning from history, right? Folks that they were in Italy. In Italy, the first case was reported February 20th. By March 15, that was case one. By March 15, Italy had already more than 22,000 cases and over 1,600 deaths. So the rate of infection with this virus, it's high. If you become in contact with somebody, the way it will happen is that you need to bring it to your mouth, bring it to your nose, bring it to your eyes. Otherwise, the virus has no chance of getting into you, unless if you get, very close to somebody, they cough on you, and this droplets, they touch you. So the old rule of washing your hands, try not to touch your face, that still applies. If you have a robust immune system, you can have it, and you won't even feel a thing. Because you're going to have those T cells that's going to come in and they're going to do their job. And for those who are, on the compromised side, it's very important for them to stay, away from those folks who might have it and bring it over to you, and they shake your hand and and unknowingly they'll give you the virus.
So you mentioned Italy, and we've heard that the US is 2 weeks away from where Italy is today. So what exactly is happening in Italy right now?
In Italy, what happened was what's happening here. Um, at the beginning, the government tried to take some measure, tell folks, to work from home. They canceled school, but people, they're very social. The Italians, they love family, they love friends. So what happened was that many folks didn't listen. They went out to the bars. They were still doing the social gathering. So what that allowed was for the virus to also have a party with them. And the transmission was fairly quickly. I have a beer, I pass it on to you, or I come in and I help my grandmother. The Italians, as of right now, they have about 53,000 cases. They are the country with the most mortality in the world, with 4,800 cases. Additionally, it's worth mentioning that the Italian population is an aging population. So most of the folks that are expiring or from this disease, from this virus there, they are older. The Italians, right now, they're making a hard decision of treating patient ethically and not medically. And what that means is when you have a grandmother who's coming in who's 80 years old, and you have somebody who's younger in their 30s, 40s, or 50s, you're going to pretty much treat them and say, I'm going to have to allow the 50-year-old person to live instead of this grandmother who, if she was under normal circumstances, she would have had a better chance at surviving. So the U.S., here we are. We started a little late with providing guidance to our population and telling them that they need to stay in. Now people are taking it more serious, but some others are not, as we have seen the videos. I was watching nightly news, and the spring breaker, they were still out. What that allows to do is for the virus to just hang out to and be spread. Now they're going to go back into their communities. I might not have a spring breaker in my house, but we might share the same elevator. We might share the same common area in the building. So it is a little selfish on the parts of those who don't have an immune compromise, who are younger, to sort of feel like this is not my problem. This is a virus that is attacking the whole world, and it's going to take the entire world to make a communal effort. So without all of us working towards this is not going to work.
Yes. This morning, Governor Cuomo had another press conference, and he went into New York City yesterday and was very concerned with the density problem that's occurring. People just aren't taking the 6 feet of social distancing seriously. People are still going to parks. They're walking very close to each other, unprotected at that. And even in the community where I live further north from New York City, and I've heard people in my community complaining about seeing people from New York City coming up over the weekend, just treating it like it's an outing. Hey, we've got some free time. Let's just go out and climb a mountain. Let's go hiking. Let's do this. Let's do that. And look, of course, you can go out and get some fresh air, but you have to be mindful of the density problem here, and we need to make sure that we're keeping the social distance that's necessary in order for us to protect ourselves and our families.
Absolutely. Many of our politicians, they have said it. We're fighting with an invisible enemy, and that is very true. And I could have it right now, and I don't know that because it takes 1 to 14 days for me to develop symptoms. During that time doesn't mean that I'm not infectious. It means that I can still give it to somebody else. So I have taken my own measures of not visiting my grandmother, because I want to make sure I protect her. If she needs something, I will go deliver the groceries. We're not going to come in contact, because I probably will fare better than she will. But it's important for the young folks to also understand that you're not 100% out of this. There's still a chance that if you become sick, that you can fall into the severe or critical cases. In New York City, the numbers that we're seeing is that about 40% of the cases are young folks. They're doing okay, As far as the mortality goes, the older folks, again, we're seeing them having a higher mortality. But if this continues to develop, which it will, our healthcare system is going to be overwhelmed, which already is. And then if you're not finding the proper treatment, that could be a terrible situation. So we need everybody to work on this.
Yes, absolutely. And in addition to the actual infection, the actual virus, the other health-related societal impact is an increase in stress and anxiety. So what are some healthy ways that people can manage the stress that we're currently experiencing due to the uncertainty of how things are developing?
I would recommend folks do a video conference, get your friends, continue that book club that you have. Many different, platforms that you can use. We're using one right now. Try to do some exercise. You can, if you live in an area that allows you to go out, you can still go for that walk in the morning and try to keep yourself at a distance from other folks. In New York City, that's a little bit more challenging. But there are hours that you can pick that are less, crowded. And exercise in your house now, many apps and many videos are online teaching you how to stay healthy, and try to eat healthy. I know that now we're going to stay home and we're going to be making more trips to the refrigerator. And, we'll see what the outcome of that is going to be. But try to stay in touch with your friends and family. And it's okay. It's okay for us to be fearful of this situation. If you feel like that, it's not an abnormal feeling. But we will get through this. We have gotten through this before. In 1918, we had the Spanish flu. It killed many, many, many people. And back then, we didn't have the technology and the advances that we have today. But today, what we need is for us to listen to our healthcare officials, go to the CDC website, go to the World Health Organization, your local health department, and get your information from them. Because they are the one who know what's happening at a global, at a federal, and at a local level in your community. And if we all take a proactive approach, we will get through this. And you see that China, they are reporting that there's no cases, no new cases happening there. So there is light at the end of the tunnel, even though now it doesn't seem like that because we are going on a peak. We're going up. And the numbers are going to continue to go up. I've been following this for about a month already. And you see that the US have been climbing up in the ranking. Today, we are number 4. By tomorrow, we'll be number 3. Italy is number 2 with the number of reported cases. Because of the numbers game, the US is expected to be number 1 in this situation. So, but if we all take a proactive approach, we can make that curve flatten a little bit.
Right, we all have to do our part.
Absolutely.
If some of our viewers or listeners want to get in touch with you, how can they do that?
They can get in touch with me via email. I also have a LinkedIn account, which I'm pretty active and try to post articles or peer review from peer review journals. So eTorres1 at binghamton.edu. So that is ETORRES, the number 1 at Binghamton, BINGHAMTON.edu. I know that many people, they spell it with a P, but it's a T. And we're here. We're all in this together. It's going to take a communal effect. And make sure you wash your hands.
Well, thank you so much, Edwin. I really appreciate you taking the time to enlighten us today. We've walked away with a lot of good, solid information. And to all of our viewers and listeners, thank you so much for tuning in. And until next time, God bless.
Thank you.